Hello, I'm Yvette Torres, and welcome to another edition of The Road to Recovery. Today we'll be talking about the social services system, supporting prevention, treatment, and recovery services for individuals and families. Joining us in our panel today are Fran Harding, Director, Center for Substance Abuse Prevention, Substance Abuse and Mental Health Services Administration, U.S. Department of Health and Human Services. Sis Wenger, President and CEO, National Association for Children of Alcoholics, Rockville, Maryland. Nachshon Sohari, Program Administrator for Substance Abuse Treatment, Denver Department of Human Services, Denver, Colorado. Donetta Jefferson, Recovery Specialist, Bridges Incorporated, The STARS Program, Sacramento, California. Fran, how prevalent are alcohol and drug use disorders in the United States?
Well, currently we have 23.2 million people in our country that need treatment, and approximately 9 million are currently in treatment.
Very good. And Sis, in terms of really providing services to these individuals, there's a whole new way of approaching addiction prevention, addiction treatment. What is a recovery-oriented system of care?
It's a system that starts with prevention and early intervention and treatment and recovery support, and it comes from multiple sources. So if we really have a system, that means that the people who do primary treatment are collaborating with the people who do early intervention, are collaborating with people who are going to provide recovery support. And it also is increasingly including the family members. We now know that tomorrow's addicts come from today's addicted families. We also know that that can be stopped if we provide appropriate services to the family members, especially the developing children. So it's a across the spectrum kind of system. It's a new paradigm, and I think it will create a tremendous amount of positive recovery in this country if we can stay with it.
Nachshon, you're in the field, you work in Denver. Tell us a little bit, have you had an opportunity to begin to shape a system that mirrors what Sis has just said?
Well, we've been really fortunate because we got a new grant from the Children's Bureau that's allowing us to create what's called family-focused treatment. Kind of like what Sis was talking about, how to try and treat addiction in isolation of the client at hand is really missing the complexity of the problem. And so we really are reaching out to the extended family members, bringing them in so not only so that they can get an education about what addiction and recovery is about, but also support for them, because their lives are difficult. Oftentimes the family members who are taking the kids in kinship care, and so they have a lot of stress and pressure on in that way, and resentment may build up over the situation they find themselves in. So we're reaching out to those extended family members to help them out. And what we're finding in a program that we started called Denver Effect, that when we are working with the whole family as a unit, the client is no longer the individual, the client is now the family. We're just seeing tremendous results.
Donetta, you in your field also deal with a lot of families, and are you experiencing that some systems are beginning to work differently?
Yes, I'm fortunate to work for a program that allows a parent to take a voluntary approach into, it's called informal supervision. And what we do, we work with the parents, with the children that are in the home, and we help them to get treatment and also provide support with them. And also we have a court, it's called the Early Intervention Dependency Court, and what that does is hold the parents to a level of accountability so a petition won't be filed in the courts. And so we're able to see great results.
And where do these families come from? Are they court referred, or do they come through other systems?
They're court referred in a sense. It's the Child Protective Services. You know, they evaluate the risk of the family, and if the risk is not high enough for the children to be removed, we work with the families with the children in the home. So they're referred through the county Child Protective Services.
You yourself went through a time where you were in need of services. You want to talk a little bit about that?
Yes, I actually, my children were removed from my care. through the Child Protective Services. And what they did, they offered me.
Why were they removed?
Well, I was a methamphetamine user for 21 years, and I actually left them with my mother for some time, and I came through CPS through abandonment of my children, which was very true. And so they offered me services, and I also attended dependency drug court, which is a level of accountability holding the parents accountable to receive the service, take advantage of the service, and have the children reunified. So they were reunified with me.
And how long were you in that process?
Approximately almost 18 months. Yeah, almost 18 months.
And Fran, in these areas where the families are treated along with the person that has the addiction, there's a lot of prevention that goes on with those children, is there not?
Yeah, there is, and that's one of the advances that we've made in our system of care. We used to have prevention programs that only focused on the kids that were at highest risk. Now we have programs that are working with treatment programs like your own and the court systems, so that we can help the children of the families to break the cycle, as Sis mentioned, and begin to help the whole family heal together, as one part is getting treatment services, another, and spouses who are spouses of the addicted person also gets adult treatment, adult prevention services. So we can really treat holistically the entire family and the community which they live in.
Yeah, and I think the preventive piece is so important and at the same time very challenging, because it means you're interacting with people who are what you would call pre-contemplative about their addiction oftentimes, and you really have to help them understand where they're at, and bringing in the family members to help them understand that is very powerful, I think. So like what you're working with, you're bringing in the kids and you're helping them understand addiction, and when they talk about how addiction feels to them in front of their parents, that's powerful.
Yes, it has a great impact, because I think that in an addicted family, it's like a hush, you know, you can't talk about it. And so we're able to give the children information and feel safe to be able to talk about it and how they feel about it, and it impacts the parents so greatly.
And Fran, I want to come back to you, because as they're talking, the prevention approaches of the past, and let's talk a little bit about them. They weren't necessarily configured in this fashion, were they?
No, most of the prevention approaches in the past were of shock value, trying to get children not to do something because of the horrible consequences. We were talking earlier how we often try to help young people see that you have to stop using drugs now, because when you're an adult, you have consequences, and children don't respond to being an adult. They respond to today and tomorrow. We also only focused on young people, and we have learned through our conversation also that we need to focus on the adults that surround the young person, whoever touches a young person's life. So we have more now community programs that begin to change the culture. And working with the children in your program, you're not only helping the children and the families that are going through addiction, we're also helping other children and other community members by learning that if they can treat an addicted person with a health condition, then that gives permission for the other parents and the other children to start feeling better about themselves. So we've come a very long way.
And Sis, that has been your mantra for how many years?
Yes, for longer than I can count. And I think it's very exciting. I think that SAMHSA asking for the creation of the Children's Program Kit several years ago really was a statement about the need to provide a tool so that the kinds of things that Fran and Donetta are talking about can be done in a flexible way